Hello, my name is Emily Greenfield. I'm a trainee clinical psychologist working for the staff support service led by Angela Devon. This training video is to talk to you about remote working during the COVID-19 crisis. We are currently all adjusting to new ways of living and working. So for some of us, that's going to mean working from home for the foreseeable, perhaps for the very first time. There's lots of information and guidance out there at the moment, so hopefully this talk will give you a brief overview on how you can support staff with remote working. It's probably going to include some things that you're already doing, but hopefully it'll be a helpful refresher and maybe give you a few new ideas that you and your team can try. You might find that there are some perks to working from home, such as no longer having a long commute or perhaps getting to have regular cuddles with your pet. However, it's completely normal to feel a range of emotions, such as stressed, bored, anxious, uncertain, or disconnected from others. Not everybody will have an ideal space to work from. Some people will be working with kids, dogs, cats, and partners in the background. Not everybody has a home office that they can hide themselves away in. Some staff will also be juggling homeschooling their children whilst trying to do their work. Staff might also be conducting clinical work from their home, which might feel less containing, and it can be hard not having your team right there to get support from afterwards. It may also make it more difficult to separate their work and personal lives. It can also be a lot harder to maintain boundaries with working hours when working from home. It is important as a team manager to think about how you can support your team with remote working. Where possible, allow your team to have flexible working hours to help them juggle competing demands. Staff may be facing personal difficulties, including having concerns about friends and family during this difficult time. Encourage your team to have boundaries with working hours and encourage them to take regular breaks. It could also be helpful to have discussions as a team about conducting clinical work remotely. For example, you could ask your staff if they have any concerns about doing clinical work from their home. You could discuss with staff how they can ensure their environment is secure, for example, using headphones to maximise privacy when having client sessions. Plan ahead and consider with staff possible scenarios that might be handled differently when physically separated from the client. So, for example, you might want to think about what happens if the technology fails in the middle of a risk assessment, or what you would do if the client's children are present in the room. It will also be important to consider how the loss of shared office spaces and physical proximity may be mitigated. Staying connected is really important for well-being. So, for example, you could schedule regular virtual team meetings, and you could also think about making time to socialise virtually. So, for example, you could schedule in a digital coffee break or a Friday online get-together. So it's important to choose different things. Some staff might like a quiz, others may like a chat or a lunch. So try and mix it up and have a few different options. You could also think about different ways that staff can support each other. So, for example, if someone had a particularly difficult client contact, could they have a go-to person that they could get in touch with? It could be helpful to share timetables and availability between staff members so they know who's working which days and who's around them to contact. It's important as a manager to be visible and available even when working remotely, and you might have to get a little bit creative with how you can do that. Remember to check in with staff one-to-one as well as having group meetings, and encourage staff to talk to you if they're feeling isolated or if they've had a difficult client contact. Ask them what you can do to help. Make sure that staff know that you're available and there to talk to if they wish. Let them know the best way of contacting you and when you are free to catch up. Staff may be working with high levels of risk, and it may be much more difficult to manage that without seeing people face to face or whilst implementing social distancing measures. Remind staff that they're not holding that risk alone. It's much harder to know how people really are when we're not seeing them in person. In virtual meetings, we often only see a tiny image of someone amongst a sea of faces on our screens. The usual cues that indicate to us that someone might be struggling are lost. For example, that someone may be quieter than usual in the office. Often when we ask people, how are you? They give a supermarket checkout response of, I'm fine thanks, how are you? It can also be much harder for us to communicate with and support staff, as we're less able to show somebody that we're listening and that we care through our body language and gestures. It could be really helpful to model emotional expression and ask open questions. So, for example, this is a really hard time at the moment. Is there anything that's worrying you? This feels different, doesn't it? How are you finding things? I know you're juggling a lot. How are you finding things? You might also want to ask someone twice. How are you really? But don't pressure anyone to talk. But it is important that staff know that you are available and there to talk to if they wish. And you might need to repeat this offer. Remember to ask staff what they would find helpful. What works in one team might not be helpful in another. Ask your team for feedback on what you've tried, asking them what they'd like more of or what they'd like less of. All staff should be included in what you offer. Managers, senior staff, administrators, everybody. But don't make any activities or offers of support mandatory. Make them an open offer that staff can join in if they wish, but don't pressure staff to take part. However, it is important to check in with staff if they don't engage with the activities or offers of support that are available. Do this in a curious way. It might be that they don't want to join it, which is completely fine, but maybe they need a different type of support. Now we are going to go through some general top tips that you can use yourself and that you can recommend to staff working from home to help support physical and mental well-being. It's really important that staff look after their physical health. Many people won't have office furniture and may be spending all day sitting on an uncomfy dining room chair. It can also be exhausting spending all day looking at a screen. Try to have an ergonomic working area. Have the top of your screen at eye height, feet on the ground, back well supported, and at a height where your arms are at the right angles while you're typing. If you don't have office furniture, try using cushions to support you in your chair or use a box as a footrest. Working from home also means that you might be spending a lot more time without moving your body. Stand and stretch regularly to give your body a break as well as your mind. Plan exercise into your day, for example, using Joe Wick's exercise videos. Try and have a routine. So without steady schedules, the lines between work and personal time can get blurred. Try to follow your normal sleep and work patterns where you can and try to stay consistent. Get up at the same time, eat breakfast, and if you can, try to get out of your pajamas. Working at home can make us feel like we have to be available all the time, but just being present isn't any use to anybody if our mental well-being is suffering. It's really important to make time for breaks to help us manage feelings of stress. Trying to take regular lunch breaks and regular breaks off the screen. Where possible, get away from your working space during these break times. Perhaps go for a walk if possible. And if you find that you have back-to-back virtual meetings all day, try and book your meetings for 50 minutes so you at least have time for a comfort break in between each meeting. It's important as part of your routine to try and maintain boundaries. Have clear start and end times to your working day. It can be really easy to overwork when we're working from home. Consider incorporating a way to mark the start and end of your working day. So, for example, in the morning you could put on work clothes and at the end of the day change into leisure wear. You might find it helpful to close everything down and move it out of sight at the end of the day. You could even walk out and back in the front door. It might also be helpful to do an activity that takes your mind off work. For example, doing some exercise or stretching, or perhaps doing a mindfulness exercise. It could be helpful to schedule in your usual commute time and instead spend it doing a self-care activity, for example, exercising, reading, or listening to music. And it's really, really important that when your workday stops, stop working, shut down the laptop, stop checking your emails, and focus on your home life instead. It might be particularly tricky to maintain home and work-life boundaries when you're juggling childcare too. Try to make a dedicated workspace if you can. A quiet space away from other people and distractions like the TV. If you can, have a discussion with your family about your needs. Remind them that you still have work to do and you need some quiet time to do it. Share with them your schedule so they know when you're busy in meetings. It's also completely normal to feel isolated right now, but there are lots of ways that you can stay in touch with others. Connection is really, really important for our well-being. Schedule video calls and you could pick up the phone instead of emailing. If you're struggling with working at home, then speak to your colleagues or managers about your concerns. And remember, your colleagues probably feel the same way about it as you. Ask how they're doing and whether there are ways you can support each other. And as we've already mentioned, make time to socialise virtually. Most importantly, remember to be kind to yourself. This is not a normal situation and things won't feel normal. Remember, times when you feel less productive, less connected, or less helpful than usual are understandable. Remember, it takes time to get used to juggling a new work-life balance, and so don't worry about getting everything right straight away. Be realistic about what you can achieve given the circumstances, and try to relax when your work is done. For further information, please take a look at these LHS web pages. There will also be some additional handouts and guidance uploaded with this talk. If you would like some further information on how you can support your team during this difficult time, please take a look at the other training videos that we have available. There is one on compassionate leadership and another one on signs of stress and how to cope during COVID-19. Thank you so much for taking the time to listen to this video. I hope there have been some helpful ideas for how you can support yourselves and your team whilst working from home. Take care and look after yourselves. Thank you.